Very important topic related to international medical graduates. How did you find the process of finding your first job in Australia? Was it tough? Was it really challenging?
Yes, it is tough.
Always discussing with your supervisors if you're needing some time.
What are you really looking for when you're going through an application, especially from IMG, that this is a candidate that I'd like to shortlist and this is the candidate I won't really consider that? But before I go and indulge myself into it, I briefly want to tell you something about myself. I graduated from Dow Medical College in Karachi back in 2001. I did my house job or internship in Civil Hospital Karachi. Then after that I did my PLAB exam and moved over to the UK. That was one of the toughest times in my life. I wasn't able to find jobs straight away. I had to do many clinical observerships, do courses, do exams before finding my first job. And that was the happiest day of my life. After doing my UK training in emergency medicine, I moved over here in Australia to do fellowship. I completed my fellowship training, did my fellowship exam in emergency medicine, and now I'm working as a consultant for the last 5 years. The journey has been tough but beautiful and showed me a lot. This talk is more relevant to Australian international medical graduates or IMGs, but the principles are roughly the same if you're in Australia, in the UK, Canada, or even US. So I've talked to many of the IMGs and I agree, the circumstances are very difficult. Most of the IMGs have actually completed the AMC Part 1 exam, and people who've actually passed the AMC 2 exam are still looking for jobs. Some of them are actually looking for clinical observership. I recently met an ICU registrar at a place that I work. He was from Egypt and he was doing work-based competency assessment pathway for his AMC2. And I asked him that, how did you find the process of finding the job in Australia? And he said to me that finding a job in Australia was actually very easy. And I was somehow baffled that there's got to be something that this guy is not telling me. So he told me that he is an ICU specialist back in Egypt. He's done all the postgraduate exam in Egypt. He's also worked in Saudi Arabia. He's done courses and he's done lots of workshops. So for him, finding an ICU job was easy because he fits all the essential and desirable criteria. And that's true. Certain specialties like ICU, emergency medicine, and even psychiatry, there are plenty of opportunities available for people who have got relevant experience. But what about the graduates who are new? They've graduated in the last 3.5 or 4 years. They've done their internship here, maybe a couple of years as a resident back home in Pakistan, India, Bangladesh, or somewhere else. And they're trying to find their first job. They may have not done the MC2. How can they improve their chances of getting a job? First and foremost, apply as many jobs and recruitment streams across all states if you can. You need to show that you read the job description and your previous experience is in relevance with that job description. So whatever the essential criteria and the desirable criteria and the job entails, your experience matches that. So when somebody is actually reading your application form, they're able to understand that you are the right person for the job, even before interviewing you. So you need to improve your chances of getting shortlisted, and the only way to do that is to fit yourself in that job description through your experience. The other important thing is that if you've got gaps in your CV, like for AMC 1, 2, or getting married or some other personal reason, don't just write that studying for AMC 1 or AMC 2 or getting married. Professionally justify your gap. There's several opportunities available. There are communication skills courses, there are phlebotomy courses, there are mastership courses in public health and critical care. Engage and invest in those strategies. That will make you stand out and improve your chances of getting a job when you come to the job market. Let's say that you've applied for jobs. How to now utilize your time whilst you're in Australia. Find a clinical observership. When you're doing the clinical observership, make sure that you blend in the team. Most of the doctors now in the COVID situations are wearing scrubs. So buy yourself scrubs, blend in the team, go and see the patients along with your consultants, ask them questions that why this patient has been managed differently, show your enthusiasm. Also get engaged in the local teaching programs for the residents, for the registrars. Find an opportunity. If you can present a case that you've recently seen in that department, whilst you're doing a clinical observership, try find out more information about the hospital courses. Most of these hospital courses are free and freely available for doctors, nurses, and they're run by the hospital staff. You've got more chances of finding your first job when you're doing clinical observership. So make sure that you impress your supervising consultants. So when they're looking for people to hire in their department, they'll give you a preference. And when you ask for a reference to your supervising consultant, just make sure that you have impressed themselves enough so he gives you a good reference. So even though he may not be able to offer you a job in their department, when you're applying for a job in other department, that reference stands out. It speaks for you. There's no point in having a generic or an average reference. So let's say that you find your first job in Australia. Congratulations, you've done very well. This is where the real work starts. I've seen some of the IMGs failing their medical term, jeopardizing their registrations because of having poor communication skills, showing lack of enthusiasm, being very slow, and showing somewhat resistance and resilience to learn something new. So make sure that you're very efficient at your work. Zero margin of error. You show utmost respect to your medical colleagues, to your nursing colleagues.
So I'm Juliana and I finished the medical school in 2013 back in Brazil. Then I worked for 5 years in emergency departments, came to Australia to study English and then did my AMC1. That was July last year and it was great. And I finally got my first job in Australia.
All right. And how did you find the process of finding your first job in Australia? Was it tough? Was it really challenging?
Yes, it is tough, definitely. But there's annual campaigns, and so I applied for many jobs.
Tips when you're applying for jobs?
Yeah, definitely. Look, so the campaigns, they have this selection criteria, and I definitely would say focus on that, do your best, and because they're it's very important.
So you match the selection criteria with your own experience to improve your chances of getting your first interview.
Totally, and that's why I should say we gotta really value our previous experience and make the best of it to fill the selection criteria.
And tell me about your first month at job. You finally got your job, very happy moment for you. How did you find your first month?
Oh my gosh, very challenging. So that was definitely the most challenging thing I've ever done in life. Look, for me, communication was definitely the hardest thing. Not with the patients, actually it was quite surprising how easy it was, but with the team. So with the consultants and all the doctors referring patients and all the stuff, it's really challenging, really challenging.
And how do you think we can improve ourselves in communication as IMGs?
Well, look, first thing, I used to do a lot, just read all the medical records a lot every time I come to work, so I learned a lot from that. And just be open to learn, right? The way people talk in the hospital, you can learn a lot. So I'm very always attentive to everything, so it helps a lot.
Okay, that's good. And tell me something about, you work in emergency department?
Yeah, that's right.
How's the work and work-life balance?
Yeah, look, it's a very demanding job. We all know that, but I really love it. I came here with my son, so he's a young child, right? So finding a balance is very important. And I was quite lucky because I got a job just by the beach, so we have lots of time, swimming, surfing, and exploring around. So it's beautiful. Yeah.
Give me your top 3 tips for IMGs.
So I would say the first thing is value your previous experience, definitely. Also for the AMC1 preparation, questions. Just the question banks are great, so just do it a lot. You're gonna get it. And then you have to be open to relearn. So this is the main thing, and I think in that way you can adapt quite easily to the system.
Brilliant. Thank you very much, Julia.
You're welcome.
I wish you all the best.
Yay.
Mohammad, tell me something about yourself. Where'd you come from?
Yes.
And how long have you been in Australia?
I came from Lebanon. I came to Australia back in 2012. I graduated in Lebanon in 2007. I worked hard initially to get to get through the AMC. I got my AMC 1 and started to look for work as a resident. Look, as an international medical graduate, I believe that it was really challenging for me to find a job. So it was really competitive, and I consider myself lucky to get a position in one of the big teaching hospitals in Sydney.
Tell me about your first month at work. As you said, you were working in a large teaching hospital in Sydney. It must have been really overwhelming. Tell me about your first few weeks. How did it go?
Yeah, look, I think it was really challenging for different reasons, I believe. I didn't have enough orientation initially. The second challenge was that I was started on a very busy rotation. It was a vascular surgery rotation, overwhelming, always busy. So waking up early, leaving late, you have to keep your job, at least according to the priority.
Okay. Tell me about your top tips in terms of finding the first job.
It was really challenging. It was like a mid-year intake. Once I got that opportunity, I just take it. So that would be my first advice.
What about the first 1 month at job? You said it was very hard for you. Please share with us some of the tips. How can you deal with those challenges whilst you're at work?
Right. So when you start your first job, just always ask. Don't keep it to yourself. Talk up and ask. Anything you don't know, you're not sure about, ask your supervisors, ask your registrars or your seniors, because this will help you to progress in your career.
Excellent.
That's
Thank you
correct.
very much, Mohammad.
Thank you.
Enjoy your work.
Thank you very much.
If you're aspiring to become a basic physician's trainee, you want to become a cardiologist, you want to become a gastroenterologist, make sure that you register with the college. Try sit the exams if you can as early as you can, at least the part 1 of that exams. The other thing is do as many courses as you can whilst you're on the job. That will improve your understanding of the workplace. That would also improve your chancing of having a next job, a better job from this current job. Imagine that this work that you've got or the first job that you've got is like a ladder, and you need to perform at every rung of the ladder better than the last rung, so that when you're applying for advanced trainee positions, your career shows a good spectrum of solid performance. That's very important for you to know at this early stage. Here we are with the Director of Shell Harbour Emergency Department, Dr. Peter Smith. Peter, this video is mainly about IMGs. Most of the IMGs who are looking for their first job, when they find their job, the challenges they face on their first job. And I just want to basically get an idea from you in terms of the whole process. Firstly, about the application form. What are you really looking for when you're going through an application, especially from an IMG, that this is a candidate that I'd like to shortlist?
One of the critical bits about any job application, whether it's from an IMG or from a local graduate, is how it's presented, the professionalism of that application, and ensuring that it makes sense, that it answers the questions, that the grammar is correct, that the spelling is correct. It is really disheartening to receive an application that shows no understanding or little understanding of what's going on with the way that we present ourselves professionally. But ultimately, this is something that is designed to reflect what you are. And if it's presented in an untidy and an incorrect fashion, it doesn't reflect well on the person that's presented it. The next thing we want to look for is the content of it, to decide whether in fact we have something that is equivalent in terms of training. It's difficult for us as Australian consultants to understand what emergency medicine is like in some of our overseas countries. And we have to rely on what is written in the application to give us some idea of equivalence when it comes to the training with the process. And then the third thing, I guess, is that we've got a breadth of experience that has relevance to the practice of emergency medicine. And that would be the final sort of component when it comes to the applicants. And then enabling us to decide whether in fact this is someone that we would like to interview.
All right. So in essence, you'd like to first see a very explicitly done application form without any spelling mistakes and without any sort of grammatical mistakes, and proofread that, go it through and then submit it, because that's really their chance to getting shortlisted. Plus match the job description.
Yes.
With their relevant, albeit it's more or less, whatever the experience they have got, just match that job description. Now, Dr. Smith, what about the interview? When the candidates are finally shortlisted and have now been invited for an interview, what are some of the things that you're looking out for and you consider that they're important for them to have a successful outcome?
Ideally, and I may be old school here, but ideally we'd like a face-to-face interview. It enables us to see the person, to actually get that interaction, that personal interaction that is so important when it comes to whether you can work with this person or not. When they do turn up, hopefully you've got someone who is professional, who is dressed appropriately, who is respectful, but has also been coached in how to relate to the individuals in the interview panel. It can be quite intimidating. I have no hesitation in suggesting that. I've been on both sides of the table on a number of occasions. You've got a couple of individuals who are highly credentialed and perhaps a little intimidating, not necessarily giving too much in the way of emotion, and you're trying your best to present the best possible image of yourself. We want people to give answers that are real, that are not necessarily book-based. It's important to have that knowledge, but we're looking for folk with experience. And the best way, I think, to display the level of experience that you've got is to actually give examples, regardless of the question. Give examples that you've got from your own practice that says that I've seen this, I've done this, this is what I would do, this is how I've done it in the past. Be open, be honest. We can tell fairly clearly if someone is coached via a textbook and hasn't had the experience that we're after.
Excellent. So basically, whatever the question is, relating your own personal experience to that response would be a nice way to start the interview process. Now, you've been working as a senior emergency physician for a number of years. I have myself worked as your registrar and you've taken me through the fellowship exam. So you've been a mentor to me, and I'm sure many other emergency physicians. Tell me some of the things that you look out for in an IMG when they're working with you on the floor. What are the particular challenges that you think they face, and how can they overcome some of the challenges?
Another very good question. The main issue that we find with the IMGs is the communication side of things, both written and spoken. You will learn what it is to practice medicine in the Australian system. You will learn that there's an interaction, a team that is required with nursing staff, with clerical staff, with medical staff, junior, senior medical staff. Everyone has a role and is respected in what they do, be they male, be they female, but no one can function if the communication is poor. Communication is critical, and that requires the individual, the IMG, to actually be proactive in that front, to ensure that what they're saying is relevant, is real, and can be then translated into something written that is, again, relevant and appropriate for the patient before them. We need to be able to paint a mental picture listening to the individual that's speaking to us. So that's important when it comes to the presentation orally. We need to also paint that mental picture when we read someone's notes. We have to have clear direction as to which way they're headed, what they think is going on with the patient, and the appropriate management and disposition. That'll come through experience. That'll come through being, as I say, proactive. It's of no value sitting back and letting things flow past you. You have to be able to step up and have the conversation with your registrar, with your consultant, so they can listen, they can direct, they can guide, they will give you feedback, and if they don't, seek it. It's very important that you are proactive in that regard.
Now, you have assisted many of the candidates through the various exams, especially the fellowship exam in emergency. And do you think the reason that some of the IMGs find it particularly challenging, is it because of the breakdown in their communication skills despite having adequate knowledge?
I take my hat off to anyone who can get through medical exams and get to the fellowship exam when English is not their first language, because medicine essentially is the third language. And it's a really, really difficult sort of interplay. Much of what's going on with medicine now is the interpersonal relationships. That's what's being assessed. That's what determines the quality of a doctor, their capacity to understand the emotion, to understand the psyche of the patient, and to then discuss that and present that to someone else. Empathy is a big part of it, and empathy comes through actually showing that you understand and reflecting that back. That is a significant problem. It's not something that you can necessarily teach. It's something that you feel, but that feeling then comes out in the way that you speak, in the way that you communicate, the way that you interact. The cultural differences we would accept as being, there's no dismissing that the cultural differences exist, but the cultural differences are something that you as an individual IMG can work on. The communication side is what requires so much diligence and so much practice, and it will be the shortcoming for some folk who make it all the way to fellowship exam, because the communication is one of the key fundamentals that we look at when we come to deciding whether this person is going to be able to practice as a specialist in years to come.
So Peter, in a nutshell, you think that for an IMG to really consolidate their communication skill is by way of practicing, talking more to their colleagues, to the consultant, and to the people in community? Do you think that might be one of the solutions?
Any opportunity you have to have a conversation, whether it be in the tea room, whether it be in the corridor, whether it be with the clerk, whether it be with the receptionist, whether it be with the individuals that serve you in the supermarket, any opportunity you have to have that conversation so that language becomes automatic. But from a medical perspective, you need to have that conversation in a medical context with someone who has the time to listen and has the time to feedback. You will be expected to present cases. That'll be part of your everyday practice. And if you cannot do that, then you won't progress in the field of medicine.
Thank you very much, Dr. Peter. Thanks for your time.
It's been a pleasure.
Thank you. I wish you all the best, and just remember that you will get through, provided you work hard, stay persistent to achieve your goal, no matter the circumstances, and success will be at your doorstep. Thank you and goodbye.